In this new episode of Skin of Color Savvy, the art and science of treating patients of color, we present to you clips from our 3 most viewed episodes of last year. These episodes feature conversations by SOCS leaders, including Andrew Alexis, Crystal Aguh, Shawn Kwatra, John Harris, Nada Elbuluk, and Michelle Rodrigues. We hope you enjoy. In this clip from our first episode, Doctors Alexis and Kwatra discuss diseases impacting patients with skin of color more heavily.
When I was doing my residency training and practicing as a junior faculty member in Baltimore, Maryland, I was struck with this disconnect. All the images I was seeing in many of our textbooks and many of the guidelines and diagnostic criteria were focused almost totally on Caucasian populations. And coming through our doors and our clinics, I was seeing a ton of diversity and very incredibly variable presentations of these patients. And that highlighted that there seemed to be some differences that weren't actually noted in the literature just a few years ago. So we've tried to meld what we're seeing at the bedside and using all sorts of tools to help us make some insights. So using large data sets, using bench to bedside research, taking blood samples and skin samples. And actually, it's pretty remarkable because what we're seeing now, even from a molecular standpoint, helps to explain some of these high-level observations. So right at the top, our group did a study recently published in the British Journal of Dermatology a couple of years ago and found that actually there are some differences in itch broadly. So African-American patients, Asian patients, oftentimes are disproportionately affected with chronic itch. When you look at certain diseases, there are certain diseases that are heavily affecting skin of color patients. So atopic dermatitis, much more common in skin of color patients, particularly African-American patients, as well as prurigo nodularis, where you get those hyperkeratotic nodules on the skin. There are other conditions like lichen planus, CTCL, cutaneous T-cell lymphoma that have unique presentations. But at the top, there's differences broadly with how often are these diseases occurring. And what I think is really fascinating is itch is actually a mirror into society because you have the epidermis and then you have these nerves, these thinly myelinated A delta fibers and unmyelinated C fibers. And Andrew, they come almost all the way out to the epidermis, the dermis. And so it really reflects many different things. Your environment, for one. So say there's socioeconomic differences and you're in areas that are heavily polluted. Well, that particulate matter, pollution, is actually more likely to trigger this nerve that then autoregulates and creates an inflammatory cycle, itch scratch cycle that leads to this eczema. The quality of your diet. There have been studies about the microbiome as well. So I really think itch is a lens broadly into society. Maybe I'm getting too philosophical about it, Andrew, but that's my standpoint. I really think itch is the key to humanity. Is that too far?
Let's go with it. Yeah.
Let's go with it.
If anyone knows, it's you. So.
No, it's special. And, I wanted to pick your brain too, Andrew, because you've been doing this for a lot longer than me, and you're someone I honestly as a mentor and friend. And I know we published separately together. You've talked about this a lot. And I learned from you initially also about the differences in presentation of several of these itch disorders. Like, for example, atopic dermatitis. Would you mind going through what you're seeing in many of our skin of color patients? And because I honestly love hearing it straight from you because you were actually the initial pioneer in this space.
No, that's very kind of you to say. Thank you, Shawn. I'm certainly wouldn't call myself the initial pioneer. There's many before me and many with me who have worked in this area. But when it comes to, I think it's a great idea to talk about a specific disorder where itch is front and center. And why don't we start with atopic dermatitis? Because we all recognize what a burden itch has on our patients who suffer with atopic dermatitis. So when it comes to differences in atopic dermatitis in patients with skin of color, the first thing we recognize is variations in how erythema presents itself. So whereas erythema in the purest sense, from the word erythema that comes from the Greek word for red, in lighter skin types, we see shades of red and pink, but in the context of the spectrum of richly pigmented skin types, this redness might not be just pure redness. We might see variations in color, violaceous to gray, reddish brown, and other hues. And so I think that as a first step, sort of broadening what you think erythema looks like, or broadening the definition of erythema to go beyond just red and shades of red and pink and include these other hues, I think is a helpful way not to underappreciate this marker of inflammation in the skin.
In this clip, Doctors Elbuluk and Rodrigues highlight ways to treat hyperpigmentation and advice on differentiating between pigmentary disorders.
So I think why don't we just start out with just talking about common pigmentary disorders, because I think people don't realize how many there are. And I often will get this really loaded question, and you probably get this too, which is, how do you like to treat hyperpigmentation? At which point I always have to pause and say, well, let's backtrack and talk about what kind of pigmentation it is. So if you could just maybe talk about the most common pigmentary disorders, and then we can delve a little more into, diagnostic workup.
Yeah, no, that sounds great. And you're right. There's over 45 causes of facial hyperpigmentation alone. So where do you begin? But I guess in my clinical practice, I see a lot of post-inflammatory hyperpigmentation. I see a lot of acquired dermal macular hyperpigmentation, which is the new umbrella term that describes lichen planus pigmentosus, erythema dyschromicum persistens, and Reals melanosis. I also see a lot of nevus of Ota and Hori's nevus. And I think the Hori's, because of the population that I treat, of course, congenital dermal melanocytosis, formerly known as Mongolian spots, is another common one that I see. And we can't go without mentioning melasma, though I'm sure we'll dive into the fact that it's not only seen in skin of color. It's not disproportionately affecting those with skin of color as we once thought. But those are probably the most common ones. Nada, what about yourself? Are you sort of feeling the same in LA?
Yes, 100%. And, I've been in LA, New York, multiple cities. Those are definitely the most common on the disorders of hyperpigmentation. And, maybe I'll just expand on that. When we move along the spectrum to hypo and depigmentation, there's a whole plethora of disorders we see there, right? Some of which are common everyday things like seborrheic dermatitis, less common ones like progressive macular hypomelanosis, seborrheic macular hypopigmentation, which we're still trying to understand, right? And then all our disorders of depigmentation, vitiligo, which is near and dear to us, and then many other causes of depigmentation, things like chemical leukoderma or, late-stage infectious diseases like onchocerciasis or pinta, things we don't see every day, but which also can cause depigmentation. So I think one take-home we really want people to remember is just how broad and how diverse pigmentary disorders are, right? And that within each of those spectrums of hyper, hypo, and depigmentation, there's a whole differential to think about. So given how broad it is, how do you start when a pigmentary patient comes into your clinic with your diagnostic workup for them?
Yeah, I think, the first thing is this hyperpigmentation? Is it their normal skin color? Is it hypopigmented or depigmented? So let's start with the hyper, because that's kind of easier from a clinical perspective. Once we work out, okay, this is hyperpigmentation, the next thing I'm looking at really is the location of the hyperpigmentation and the color of the hyperpigmentation I'm seeing, because that not only gives me an idea of the diagnostic possibilities, but also the therapeutic options that we have to treat this patient. So melasma, for example, I always think of as being centrofacial. If you see the hyperpigmentation on the neck or the eyelids or the ears, we know immediately that this is not going to be melasma. But similarly, color-wise, if we see something that's slate gray or bluish or, ashy in color, we know it's not just going to be melasma. We're having to think more about dermal pigmentary disorders like the acquired dermal macular hyperpigmentation, medication-induced hyperpigmentation. So really, I think location and color for me is a key. The other one is the history from the patient, of course. Prior to seeing the hyperpigmentation, did you see any rash, redness, scaliness, or irritation in the area? Of course, patients who have darker skin types might not see redness, and we don't see that as a clinician sometimes. We have to ask about the symptoms. So asking about that can often give a clue to post-inflammatory hyperpigmentation, as well. So I think morphology, color, and then history from the patient is key. Here in Australia, we see a lot of skin cancers, and so my dermatoscope is literally tied to me. And so I've been looking at pigmentary disorders through the dermatoscope just as a matter of routine and habit. And I know that that too can be a very, very helpful, non-invasive bedside tool that helps me differentiate where the pigment might lie. There are very, very characteristic features of melasma, of post-inflammatory hyperpigmentation with the little peppering that we see throughout the dermatoscope. So this can be very helpful also prior to, of course, embarking on a biopsy. And a biopsy is sometimes needed, and we have to choose an area that's, cosmetically not as sensitive, and maybe a 1.5 millimeter biopsy, just to make sure that we're getting the best possible cosmetic result if, of course, we can't glean that information clinically. So that's just a start from a hyperpigmentation perspective, Nada. But as you know, hypo and depigmentation are totally different kettle of fish. So.
In our third clip, Doctors Aguh and Harris highlight the importance of diversity in clinical trials, and they expand upon the value of differing perspectives.
When we're in the room of people who are involved in Skin of Color Society, we're preaching to the choir, right? You don't have to convince anyone in that room that diversity is important. But I think it's important to bring people to the table who maybe don't understand why diversity is so important. And I think about the benefits of just collaboration in general, right? So when you, like, for example, I study CCCA, and I've been looking more into the impact of metabolism. And so I asked an endocrinologist to help work on this project, right? And I need that because that person helps me identify my blind spots. What am I missing? And I think that's a perspective that almost anyone can appreciate, right? That you may not be able to see everything that is important to you in your research study. And by adding different perspectives, you just have a better study.
Yeah, that's always the case. Yeah, I'm glad you brought that up because we often, Skin of Color Society focuses on a specific type of diversity because that's a big part of our mission. But just as scientists, diversity of thought is absolutely critical. Whether it's not focusing too much on this pathway and ignoring this other pathway, or biasing yourself because of your hypothesis and not thinking of other things. Certainly happens in dermatology as well. Having a diverse differential is really important, so you don't miss something important. So I think broadening it to that is really important, which is the same as with you collaborating with somebody who knows metabolism really inside and out, and then helping you bring that into skin. I think that's a good point.
This has been an episode of Skin of Color Savvy. Thank you for watching. Don't forget to subscribe on all of your favorite podcast platforms.